Good morning. For years, society viewed alcoholism and drug addiction as reflections of personal failure, a result of poor choices, weak character, and a stubborn unwillingness to change. This view of addiction has stigmatized people struggling with substance use, and these views were evident in the language used to describe them, such as junkies, crackheads, drunks, etc. Today, although the stigma persists, the moral model of addiction has been supplemented by extensive research on the effects of substance use on the brain. The research suggests that substance use disorders, or SUD for short, is better viewed as a deadly but treatable chronic illness. The New Mexico Attorney General's office states that addiction is a brain disease whose visible symptoms are behaviors. Today, I will be discussing the effects of substance use on the body and society, the statistics of substance use in New Mexico, and the resources that are available for people struggling with substance use. In New Mexico, substance use disorders are a big problem that need to be addressed because it has major effects on individuals and their families, as well as the community. New Mexico has long had some of the highest rates of alcohol and drug abuse in the country. Since 2001, the combined rates of alcohol and drug-related deaths in New Mexico rose by more than 60%. In Albuquerque, there are 125 persons aged older than 12 that used any illicit drug in the past year. This is 17.2% of the population, which is higher than the national rate of 14.7%. For prescription type pain relievers, 6.4% of the population abuse those substances, which is higher than the rate for New Mexico, which is at 5.8%, and also higher than the national rate of 4.9%. In the Albuquerque Metropolitan Statistical Area, or MSA, 21.2% of the persons aged 12 or older participated in binge alcohol use. The Albuquerque Metropolitan Statistical Area consists of Bernalillo County, Sandoval County, Torrance County, and Valencia County. When it comes to substance use, there are short-term and long-term effects on the body and brain. The short-term effects of alcohol include dizziness, slurred speech, blackouts, hallucinations, fatigue, etc. Heavy drinking can also lead to alcohol poisoning, which can be fatal. For opioids, which include oxycodone, hydrocodone, and morphine, the short-term effects include nausea, vomiting, fast heart rate, slowed breathing, coma, and overdose, which can also be fatal. Some drugs can have long-term effects that can last for years. These effects can be physical or psychological. In time, drugs can damage the brain, heart, liver, lungs, kidneys, and many, many more. According to the National Institute on Drug Abuse, they state that long-term use of substances boosts a person's risk of cancer. Snorting drugs can also ruin nasal linings and can cause injury, while injecting drugs increases the risk of getting HIV and hepatitis. A common result of drug use is mental illness. Mental illness can affect a person's life as well as the people in their life. People living with mental illness are at a higher risk of suicide. Drug use can also cause depression, which also leads to a higher risk of suicide. Substance abuse can also impact the community. Individuals suffering from substance abuse can impact their families with an increase in child custody losses, an increase in child abuse and neglect, and also an increase in addiction risks for children of drug-addicted parents or guardians. There are also increased rates of homelessness and poverty because it is hard for individuals struggling with substance use to hold down a job. Also, many violent crimes on college campuses that have been reported involve the use of drugs or alcohol. Some resources that are available for those that are struggling with substance abuse are a community-based rehabilitation. This resource places equal emphasis on inclusion, equality, and socioeconomic development. This resource will treat the whole person and is created for every individual's needs. There are also resources available for families of those suffering from substance abuse, such as family therapy. Family therapy is a set of therapeutic approaches that attempt to use the family's strengths to help them cope with their loved ones' substances. So to conclude, in New Mexico, substance use disorders are a big problem that needs to be addressed because it has major effects on the individuals and their families, as well as the community.